It is the first day that you can sign up for healthcare insurance under the new Covered California here. With us this morning is Craig Gusson. He is a health insurance broker to tell us just about everything we need to know here this morning. Good morning to you.
Good morning, David.
First of all, let's talk about the number one. What are you doing these days trying to figure all this out? You just told me your schedule. It's ridiculous.
Every day I'm meeting with another insurance company. They're having meetings in San Diego, and they're explaining to us what their plans are. So far, we're hearing about plans, we're hearing about benefits, but we're not hearing about cost. So we have not, most of the companies outside the exchange have not released their rates to what they're going to be. So it's going to be a wait and see.
Is it because they just don't know themselves what the rates are? Or are they just hiding it? I mean, because it's going to be bad news?
It hasn't been approved by the insurance commissioner's office yet. They haven't put their, their seal of approval on it. So they don't want to make it public yet.
But wait a minute, today's the day.
I know, but the only ones that really have been announced out there is Covered California. I have to assume that Covered California rates have already been approved by the insurance commissioner's office. I know it wasn't a week ago, but I have to assume because today is in fact that it is. But again, what we're recommending to everybody is do not buy health insurance yet. Wait until the end of October, beginning in November. Let's look and see what's out there in the exchange, outside the exchange. Get an understanding what the plans are. I mean, I'm an agent, and I don't understand all the plans yet. We're still trying to get educated of what's covered, what isn't, and the major issue is hospitals and doctors. If you're in Covered California, there is a really good chance that either Sharp or Scripps will not be in the network you pick, or possibly both.
Sharp or Scripps?
Yes.
Which is, of course, two of the major providers here in San Diego.
Exactly.
They both may not be part of this deal?
In some plans in Covered California, they could both be out. In other plans, they could be excluded from one or the other.
Okay, let's back up and just talk. Say I've got coverage through my job, and a lot of people that are watching this morning are heading off to their jobs. They've had coverage for years. They're worried about what happens. I've got coverage through my job. What happens to me?
When your group plan renews, which will be anywhere between January 1st to December 1st, you're going to see changes in your plan. They have to include what they call the essential benefits, which is they got to cover copay for doctor visits, maternity, inpatient surgery, outpatient surgery, lab, x-rays, prescriptions, stuff like that. Which means the plans are going to change a little bit. They also have to change the benefit packages of the plans. So because of that, the plan costs probably in most cases are going to go up. And the plans are changing. So what you have today, probably you won't have when your plan renews. So you're going to start getting letters from your employer stating, our health insurance is coming up for renewal, our plan's changing, here's what it looks like, here's some options, or by the way, our agent's coming by on so-and-so date. You may want to attend this meeting, and I really recommend doing this because in the past you'd say, yeah, I'll just keep my coverage.
Right.
But now you got to understand, okay, what's my new coverage? Is my doctor in the network? Is the hospital I like to use in the network? And you got to really understand every part of it. It isn't like I'm just going to keep my existing plan. Because regardless if you're a small group under 50 or a large group over 50, your plan's changing January 1st along with individuals. Everybody's plan's changing in 98% of the time.
January 1st or perhaps June when your particular plan with your company may change. So not only will your provider might be changing, but your entire coverage, either more or less coverage, that may be changing too. You're going to have to pay particular attention to what you get for your dollar, right?
Exactly. And what you're seeing is, to keep costs down, is people may end up going with a higher deductible and, again, higher copays. And you got to really be very attentive to what's in the plan and understand and make sure it fits your family's needs or your individual needs.
Boy, it's scary going into this, isn't it?
It is. It's a lot of education you got to understand. But the nice part is that we have 3 months till January 1 to get it done. Just take your time, work with your agent, and come up with a plan that meets your particular needs, regardless if it's through your employer or on your own.
Okay, what about Medicare? If I'm covered by Medicare right now, does it affect me?
Not at all. Medicare is a totally different animal. It's not. There's no changes that I know of as of now. So I wouldn't even worry about it.
All right, that lowers a lot of anxiety for a lot of folks out there right there. If you're being covered right now. No change whatsoever. Hey, we've got so many more questions for you. Can you come back every hour this morning and we'll try to discuss, break it down a little bit each time? Okay.
I will say about Medicare, though. Medicare open enrollment starts in October. So if you have a Medicare plan, you can make changes to it, but it's not affected by the health care reform laws.
Okay, Craig, thank you so much.
My pleasure.
We'll see you in the next hour.